morning, everybody from this side of the world. I'm Dr. Temitope Farombi, and I'm a neurologist at the University College Hospital Ibadan. I work in geriatric center where we have over 20,000 enrollees of older adults, and I'm the only neurologist taking care of neurodegenerative disease there. Also, I'm also the convener of Dementia Not Witchcraft campaign, which was born out of experiences in the clinic and in the community. Age is the commonest cause of dementia, is the commonest risk factor that is associated with dementia. It's a disease of the older adults, people that are 65 and above are at higher risk, and every 10 decade increase on age increases the risk of dementia. Like someone who is 70, we have lesser risk compared to someone who is 90. And what also that we found that gender, female gender tend to have higher risk of dementia. This might be as a result of cumulative event of stressful condition. People had come up with the fact that female live longer than male, and this might be the reason why we see a lot of, and hormonal component also is being looked at here, looking at the estrogen and the progesterone and what is lost at menopause. So female gender is seen to have dementia compared to male gender. Other risk factors include family history. Someone with family history of dementia is at higher risk of developing dementia than someone without family history or genetic history. Genetics, like someone with genetic problem. Example, it's someone with Down syndrome that are at higher risk of developing dementia, Alzheimer's disease. Other risk factors are smoking, excessive alcohol use, atherosclerosis, excessive cholesterol in the body, high blood pressure, uncontrolled high blood pressure, and recurrent strokes and diabetes. And there are so many more risk factors. Lack of sleep, increased stress is becoming an important risk factor for developing dementia. Other risk, lack of education also is a risk factor. Decreased learning, it's saying that people who don't learn, who don't have increased exposure to learning period are at higher risk of developing dementia. So how do we reduce this risk? We can't reduce aging. These are uncontrollable risks. We can't do that. People will have to age. However, and you can't change your gender as a female. So these are irreducible or irredeemable risk factors. However, there are some risk factors that can be taken care of, apart from being aging or being a female. If you have hypertension, control of your hypertension, taking control of your total health, hypertension, diabetes, cholesterol in the body, taking care of those will reduce the risk of dementia. Of course, it's going to reduce the risk of stroke also. Also, when you stop smoking, because smoking has been shown to thickens the blood vessels, and these are the things that can cause reduced blood flow to the brain and all that. So stop smoking, and also eating healthy. Studies have shown that people who eat healthy, who eat high fiber diets, who eat vegetables and all that are at lesser risk of dementia. So eating healthy is very important. Avoiding refined food, had too much salt in the food, and also unsaturated fat. So eating healthy is very, very important. Exercise also. Exercise has been shown to reduce the risk of dementia and memory loss. And these are evidence-based activities that actually improves cognitive health, and also drinking less of alcohol.